1. What is the primary role of a medication aid? A. Diagnose medical conditions. B. Prescribe medications. C. Administer prescribed medications under supervision. D. Perform surgical procedures. 2. Before administering medication, what must a med tech verify? A. Insurance status. B. Pharmacy license. C. The 6 rights of medication administration. D. The nurse's lunch break. 3. Which route of medication administration involves placing the drug under the tongue? A. Oral. B. Sublingual. C. Buccal. D. Topical. 4. What does PRN stand for in medication orders? A. Professional registered nurse. B. Prescription renewed now. C. As needed. D. Pre-registered number. 5. A resident refuses to take a prescribed medication. The med tech should A. Force the medication. B. Hide it in food. C. Document the refusal and notify the nurse. D. Ignore and discard it. 6. What should a med tech do before pouring liquid medication? A. Shake the bottle. B. Pour from a distance. C. Estimate the dose by eye. D. Warm the liquid. 7. When should a med tech wash their hands? A. Before and after medication administration. B. Only after giving injections. C. Only before touching residents. D. Once per shift. 8. Which of the following is a common side effect of opioids? A. Diarrhea. B. Hypertension. C. Constipation. D. Weight gain. 9. Which medication form is applied to the skin and absorbed into the bloodstream? A. Tablet. B. Suppository. C. Capsule. D. Transdermal patch. 10. A med tech should check the medication label. A. Only after administering the drug. B. 3 times, before, during, and after administration. C. Once per shift. D. Only if unsure. 11. What is the purpose of a MAR or medication administration record? A. To write care notes. B. To track staff attendance. C. To record and verify medication administration. D. To list diagnoses. 12. If a medication error occurs, what should the med tech do first? A. Tell the family. B. Document and ignore. C. Report to the supervising nurse immediately. D. Leave the facility. 13. What is the best way to measure a small dose of liquid medication? A. Teaspoon. B. Plastic cup. C. Oral syringe. D. Measuring tape. 14. Which of the following is an example of a controlled substance? A. Acetaminophen. B. Ibuprofen. C. Morphine. D. Multivitamin. 15. What is a contraindication? A. A reason to prescribe a drug. B. A lab result. C. A condition when a drug should not be used. D. A pharmacy code. 16. Which organ is primarily responsible for metabolizing medications? A. Lungs. B. Heart. C. Liver. D. Stomach. 17. Enteric-coated tablets should A. Be crushed. B. Be chewed. C. Be swallowed whole. D. Be dissolved in water. 18. A resident complains of dizziness after taking a new medication. The med tech should A. Ignore the complaint. B. Report it to the nurse. C. Offer coffee. D. Increase the dosage. 19. How should a med tech handle expired medications? A. Flush them. B. Give them if needed. C. Dispose according to facility policy. D. Save them for emergencies. 20. A diuretic is prescribed to A. Increase blood sugar. B. Lower cholesterol. C. Promote urination. D. Increase heart rate. 21. The abbreviation BID means A. Once a day. B. Every other day. C. Twice a day. D. As needed. 22. Which is not a standard medication route? A. Oral. B. Rectal. C. Intravenous or IV. D. Olfactory. 23. Which condition requires blood glucose monitoring? A. Asthma. B. Diabetes. C. Arthritis. D. Tuberculosis. 24. What should be done if a resident vomits after taking a medication? A. Re-administer the dose immediately. B. Skip the next dose. C. Notify the nurse. D. Ignore it. 25. How should eye drops be administered? A. Directly on the eyeball. B. Into the ear canal. C. Into the lower conjunctival sac. D. On the eyelid. 26. Which class of drugs is used to treat high blood pressure? A. Antihistamines. B. Antiemetics. C. Antihypertensives. D. Antacids. 27. Crushing tablets should only be done A. With approval from the pharmacist or nurse. B. To save time. C. For all elderly residents. D. Without documentation. 28. Which information must be on a medication label? A. Doctor's education. B. Patient's weight. C. Expiration date. D. Manufacturer's phone number. 29. Which is a side effect of antihistamines? A. Drowsiness. B. Insomnia. C. Diarrhea. D. Rash. 30. The term antipyretic refers to a drug that A. Lowers blood pressure. B. Treats depression. C. Reduces fever. D. Increases appetite. 31. Which of the following must be worn when handling hazardous medications? A. Sunglasses. B. Gloves. C. Apron only. D. No protection needed. 32. Why are medications given at specific times? A. To make the shift easier. B. To align with the resident's mood. C. To ensure therapeutic effectiveness. D. To satisfy the resident. 33. Which is the proper way to store refrigerated medications? A. In any unlocked fridge. B. In a secure, labeled medication fridge. C. In the break room fridge. D. At room temperature. 34. Which of the following is a sign of medication allergy? A. Fatigue. B. Dry mouth. C. Rash and swelling. D. Appetite increase. 35. What does Q6H mean? A. Every 6 hours. B. Once every 6 days. C. 4 times a day. D. As needed. 36. If a resident is unconscious, how should oral medication be given? A. Slowly. B. Crushed with water. C. Do not give oral medication. D. Injected instead. 37. Which term describes a drug's effect being stronger than expected? A. Tolerance. B. Potentiation. C. Synergism. D. Overdose. 38. Medications must be documented. A. If the resident feels better. B. Only if requested. C. Immediately after administration. D. Once a week. 39. The abbreviation HS means A. High strength. B. Half dose. C. At bedtime. D. After school. 40. A topical medication is applied to A. The nose. B. The lungs. C. The skin. D. The stomach. 41. What is the term for an undesired, unexpected medication reaction? A. Symptom. B. Side effect. C. Adverse reaction. D. Dosage. 42. Which class of drugs helps control seizures? A. Antipsychotics. B. Anticonvulsants. C. Antibiotics. D. Antacids. 43. What must be done with a narcotic count at the end of each shift? A. Nothing, it's automatic. B. Count and document with another staff. C. Leave for the nurse. D. Guess the amount. 44. Why is it important to use the correct measuring device for medications? A. For resident comfort. B. To save time. C. To ensure accurate dosing. D. For legal purposes only. 45. If a resident is on anticoagulants, they are at risk for A. Seizures. B. Falls. C. Bleeding. D. Constipation. 46. A med tech gives the wrong dose of medication. What must happen next? A. Call the resident's family. B. Ignore it. C. Report to the nurse and document the error. D. Change the MAR. 47. Buccal medication is administered. A. under the tongue. B, between the cheek and gum. C, in the eye. D, through a vein. 48. Which of the following is a legal responsibility of a med tech? A, diagnosing. B, administering medications as ordered. C, writing prescriptions. D, changing treatment plans. 49. A diuretic may cause A, dehydration. B, drowsiness. C, rash. D, constipation. 50. The most accurate way to identify a resident before giving medication is A, room number. B, face recognition. C, name and date of birth. D, asking a coworker. 51. What should a medication aide do if a resident refuses to take a prescribed medication? A, force the resident to take it. B, hide it in the resident's food. C, respect the refusal and report it to the nurse. D, skip reporting and try again later. 52. Before pouring a liquid medication, the med tech should A, shake the bottle and hold it away from the label. B, pour directly into the resident's mouth. C, pour while the bottle is flat on the counter. D, use a syringe only. 53. Which route of administration involves placing medication under the tongue? A, oral. B, buccal. C, sublingual. D, topical. 54. A resident is prescribed a medication to be given bid. How often should it be given? A, once a day. B, twice a day. C, every other day. D, 4 times a day. 55. A med tech finds a medication that is expired. What is the correct action? A, administer it anyway if the resident has taken it before. B, call the pharmacy. C, return it to the medication cart. D, do not use and report to the supervising nurse. 56. The right resident in medication administration means A, asking the resident's roommate. B, checking the medication label only. C, verifying identity with 2 identifiers. D, asking the resident what they usually take. 57. Which medication form is applied directly to the skin? A, tablet. B, suppository. C, transdermal patch. D, suspension. 58. What is a common side effect of diuretics? A, high blood pressure. B, constipation. C, increased urination. D, drowsiness. 59. Which class of medication is used to treat high blood pressure? A, antacids. B, antihypertensives. C, antibiotics. D, antivirals. 60. What is the best method to prevent medication errors? A, work quickly to finish early. B, rely on memory for frequent meds. C, follow the 6 rights of medication administration. D, delegate tasks to non-certified staff. 61. What does the abbreviation PRN stand for? A, every day. B, as needed. C, with food. D. Before bedtime. 62. When should the med tech document a medication administration? A. Before giving the medication. B. At the end of the shift. C. Right after administering the medication. D. The next day. 63. What action is appropriate if a resident vomits immediately after taking a medication? A. Re-administer the full dose. B. Skip the medication. C. Notify the nurse for instructions. D. Give an anti-nausea pill. 64. Which vitamin is fat-soluble and can build up to toxic levels? A. Vitamin C. B. Vitamin B12. C. Vitamin D. D. Vitamin B6. 65. The abbreviation HS on a medication order means the medication should be given. A. At lunchtime. B. At bedtime. C. Every hour. D. With meals. 66. Which is a potential adverse effect of opioid medications? A. Diarrhea. B. Alertness. C. Respiratory depression. D. Weight gain. 67. Which of the following is considered a high-alert medication? A. Antibiotics. B. Antacids. C. Insulin. D. Cough syrup. 68. Which of the following is not one of the 6 rights of medication administration? A. Right time. B. Right room. C. Right route. D. Right dose. 69. What is the first thing a med tech should do before administering medication? A. Document in the MAR. B. Read the medication label. C. Greet the resident. D. Wash hands. 70. Which of the following conditions requires glucose monitoring? A. COPD. B. Diabetes. C. Asthma. D. Arthritis. 71. Which medication route is fastest in effect? A. Oral. B. Rectal. C. Intramuscular. D. Sublingual. 72. A resident with a seizure disorder is prescribed phenytoin. What should the med tech observe for? A. Skin rash and gum problems. B. Increased appetite. C. Low blood pressure. D. Constipation. 73. Which tool is best for measuring a small dose of liquid medication? A. Drinking glass. B. Kitchen spoon. C. Oral syringe or calibrated cup. D. Teacup. 74. How often should a med tech check medication storage expiration dates? A. Monthly. B. Weekly. C. Only when residents complain. D. Once a year. 75. What is the safest response if a resident questions a medication? A. Tell them not to worry. B. Say it's the same as always. C. Recheck the medication and confirm with the nurse. D. Ignore the question. 76. What should a med tech do before giving a new medication to a resident? A. Ask another resident if it's safe. B. Check the MAR and verify the doctor's order. C. Look at the pill color only. D. Ask the resident if they want it. 77. Which of the following is a common sign of a medication allergy? A. Constipation. B. Rash and swelling. C. Hunger. D. Dry mouth. 78. A resident has difficulty swallowing tablets. What form of medication might be ordered instead? A. Patch. B. Injection. C. Liquid. D. Suppository. 79. If a med tech makes a medication error, what is the correct action? A. Keep it secret. B. Only tell the next shift. C. Report it immediately to the nurse. D. Document it only at the end of shift. 80. When should you clean a resident's skin before applying a topical medication? A. Only if it's visibly dirty. B. Always. C. Never. D. Only for creams. 81. A narcotic count must be done. A. Weekly. B. At the start and end of each shift. C. Only when medication is missing. D. At the end of each month. 82. Why should you not touch a transdermal patch with bare hands? A. It might not stick well. B. It can stain the skin. C. Medication can absorb into your skin. D. It's unsanitary. 83. A resident asks if their new medication will interact with something they're already taking. The med tech should A. Tell them to stop asking questions. B. Check a drug guide. C. Reassure them it's fine. D. Report the concern to the nurse. 84. A medication ordered Q6H should be administered. A. Every 6 hours. B. Every 2 hours. C. Twice daily. D. Once per week. 85. What is the safest way to identify a resident before giving medication? A. Ask the resident's name only. B. Check the door nameplate. C. Use 2 identifiers, such as name and date of birth. D. Use the MAR picture only. CNA MedTech or Medication Aide. The CNA MedTech or Medication Aide exam, often recognized under the American Association of Medication Technicians or similar accrediting bodies, is designed to certify nursing assistants to safely administer medications under the supervision of licensed healthcare professionals. This exam assesses a candidate's knowledge of pharmacology basics, medication administration procedures, patient rights, safety protocols, documentation, and infection control. Test takers are typically evaluated through a written exam and may also complete a skills demonstration. The certification allows CNAs to expand their role in long-term care or assisted living settings by assisting with routine medication delivery. Requirements vary by state but usually include CNA certification, formal medication aid training, and clinical experience. Here are the top 5 beneficial uses of CNA MedTech or Medication Aid exam. 1. Career advancement. Earning a medication aid certification allows CNAs to take on additional responsibilities, such as administering medications, which can lead to higher wages and greater job opportunities. 2. Improved patient care. Certified medtechs enhance the quality of care in healthcare settings by ensuring timely and accurate medication delivery, reducing the burden on nurses and improving patient outcomes. 3. Increased job security. Facilities value multi-skilled staff. Medication aid certification makes CNAs more versatile, increasing their employment stability and attractiveness to potential employers. 4. Professional growth. Gaining medication administration skills boosts confidence and prepares CNAs for further certifications or nursing careers. 5. Regulatory compliance. Certified medication aides help healthcare facilities meet state and federal staffing standards, promoting legal and ethical care practices.